Anterior approach hip replacement is an approach that I've been using now for a number of years. I started doing it to reduce the risk of dislocation, and I found that over time it's had a number of other advantages for me and my patients. I like it as an approach, as it's a fairly direct approach to the hip, and one that I'm very comfortable with, having used it with other procedures of the hip. The hip is fairly straightforward to expose with this approach, and I use a table with patient lying flat on the table on their back, which is also a nice position for the anesthesiologist to be able to communicate and talk with you during the surgery. The approach for me, the other advantages of the approach is the decrease in trauma to the soft tissues around the hip. I don't have to release or remove any areas of muscle attachment or capsule attachment in the critical areas. I open the capsule in the front of the hip, which is less important for stability of the hip, and it's why I'm able to eliminate the precautions after surgery that I would have with other approaches. For me also, it has increase the rate of recovery for patients in the early phase of recovery. Patients tend to be less painful initially after surgery and find it easier to get back their strength and range of motion at an early stage, and also get back to work for patients who are working. And so that has been a big advantage. The other thing for me is during the surgery I can be more precise with implant positioning. I have an easier time bringing in the mini x-ray or fluoroscopy during surgery to check that implants are where I would like them to be at various stages during the surgery, and to reduce then the variability in implant positioning, which is also very important. And the incision is fairly easy for people to take care of. It's in the front. I make it as big as I need to see what I need to see, but it's usually not very large. It's easy for people to see and take care of it and keep it clean and dry during the early critical time of that incision healing.